object you're going to be showing me today?
I'll be showing you my blood pressure cuff. It's basically just a device that's able to test your blood pressure manually. It's so easy. It's called a sphygmomanometer. This like cuff, which you put around someone's like upper arm right here, and you put the gauge like onto the cuff, and then you'll use this inflation device, and it has this little like rotator on here, and it's just to have the air like flow out, or you can like when you pump it all up, you can have it like stay in there, which actually inflates the cuff. And then you need your stethoscope too, and then you just are able to listen to like your systolic and your diastolic blood pressure.
How often do you use this in like your classes?
Well, I guess I said I used it earlier for skills, but that's a lie. I use it for assessment. Assessment is when I'm actually just like hands-on doing an actual assessment, and then skills is like my 4-hour lab that I have. That class is fun. It's just the hardest because you have to have an 80% up or you don't pass the program.
Where you keep your blood pressure kit?
Always in my clinical bag that I got.
Do you think that object's pretty valuable to your education as a nurse?
Oh yeah, for sure. I mean, like blood pressure is so important, like because like if your blood pressure's out of range, like that can like tell so many different things, like hypertension, which you don't want. Like you want obviously normal blood pressure reading, so I would say it's pretty vital.
Using a blood pressure machine on a patient and something happens with like the service or the electricity of it, she has this manual one that she'll be able to use without any other resource.
About a year ago, my sister had to go to the hospital because she wasn't feeling very good. And while she was there, she actually found out that her blood pressure was so high she could have had a stroke. So they ended up catching it in time. Look at it as something that can almost save lives.